puesto sobre la mesa hipótesis que hasta ahora al menos casi no contemplábamos, por lo que supongo que del público van a surgir varias preguntas. ¿Alguien del público tiene alguna pregunta? El doctor Struck seguro que sí.
Gracias por la invitación. Mi pregunta es para Eric Rim. I will tell you in English. I have read some papers published by Ken Mukamal on the effects of alcohol and stroke, and in one of the conclusions was that maybe red wine might contribute better in the protective effect than other alcoholic beverages. Do you have some...
És que no... Pots sortir aquí a parlar, sisplau? És que hi ha un problema de hoy. Yes.
My question is to Eric. I have read some papers published. The first author was Ken Mukamal on the relationship between different alcoholic beverages and stroke. And one of the conclusions was that red wine may protect better than other alcoholic beverages. I think this is the unique paper published in United States that say that red wine protects better than the others. You have a comment on this?
Yeah, I know that I'm on record for the last 20 years as saying that alcohol moderation, regardless of beverage type, lowers risk of cardiovascular disease. But there clearly is benefits from polyphenols. And I think we get polyphenols from many places in our diet. We get some from red wine, but we also get some from fruits and vegetables. So I think to the extent that some of the benefits from polyphenols seem to be through endothelial function and lower blood pressure, one would expect that any food that's high in polyphenols that has the ability to lower blood pressure, endothelial function, would then also lower stroke risk. So I guess it is possible that red wine is modestly better than other beverages for lowering stroke risk, and maybe even more beneficial for people who have bad diets that don't have lots of other polyphenols in their diet. So it may be that if you looked at this in the Mediterranean diets where they already have lots of polyphenols from other aspects of their diet, that red wine may not be that much more beneficial for stroke. So I think it's possible. I think that the evidence is not as strong as the benefits coming from ethanol.
Muy bien. ¿Hay alguna otra pregunta? Bueno, si no, yo tengo...
That's a good question. They're clapping for me in the other room.
I have some questions. Please, could you explain why the polyphenols, or why do you think the polyphenols could increase the omega-3 in the blood? Which mechanism could be? For antioxidant protection?
We are trying to understand, but I do not have a definitive explanation. Possibly there is an effect through the microbiota, but we are not sure. And for the moment, I prefer not saying anything more.
No, because I think it's curious, no? Because a lot of food that has polyphenol does not contain omega-3, no? That usually omega-3 goes with vitamin E, so it's curious that they have this protection action.
Yes, of course.
Mm-hmm. Okay.
Can I ask a question to Antonia?
Yes, for sure.
So in the EPIC study that you showed from Greece, it looks like more of the most important component of the Mediterranean diet is alcohol. Can you describe, do you have any information on the drinking patterns of people in Greece? Do most people just consume alcohol every day, or are there also sort of binge drinkers?
Thank you for this question. As you have noticed from the presentation of Michel, Greece is changing to the worst as far as dietary patterns. And the young generation is abandoning the Mediterranean diet and, of course, the Mediterranean style of drinking. But our population in our epic Greek population, I think, is the last chance we have in epidemiology to have a truly Mediterranean population, because we started in the 90s, and our population at that time, they were quite old, more than 40 years old. So this refers to the true, to the population, and then we went to to remote islands, not only in Athens. So this represents a population which really, it was the last generation which followed the true Mediterranean diet. So they were, well, in this respect, because this does not happen today, that's why I'm insisting when we're talking about Mediterranean diet to know what you mean and to refer to the traditional Mediterranean diet. This may mean that they were consuming every day 1 to 3 glasses of wine or a kind of rakichi, puro, something else, which is a spirit, let's say, but it's a very small amount. Mainly by men, never the children, and the women much less, and maybe the women during the weekends or the feast days. This is the pattern I am mentioning. Today this happens in the small villages, but it's not very, very common as it was.
Okay, I have another question for Eric. Not that you commented before that the people who have some risk factors, as tobacco or they didn't do sports, and also the happiness. I think that the happiness is a very interesting thing, but we have any measurement of the happiness. It's because we can measure the sports, we can measure the smoke, but it's very difficult not to measure the happiness.
Yeah, there's a number of behavioral measures of quality of life, which measure sort of, are you involved in religion? Do you have lots of friends? Do you have phobias? And there's a number of different scales like that. And there's been lots of cross-sectional studies that show that people who drink moderately have a better quality of life. Now, it's hard to know since it's cross-sectional. Does the alcohol cause the good quality of life? Or because they have a good quality of life, do they drink in moderation? So there haven't been really many good prospective studies to show change in quality of life. We're actually working on something like that because we have repeated measures in the nurses of them reporting on these scales of quality of life. So stay tuned. Hopefully in 2 years when we have the Mediterranean Diet Conference again, I can come back and talk on alcohol and quality of life. But I think that's such an important component of it that hasn't really been, we've talked about interactions with diet and smoking and other components, but it's hard to quantitate that as well as some of our other measures.
Okay. There is any other questions in the audience? Yes, please.
Bien, mi pregunta es referente al vino. Ustedes solo hablan de
Perdón, quizá tendría que venir aquí o después,
no
si
se
no,
preocupen,
hago yo la pregunta. Es que si no, no
pasa
se
nada,
oye.
no hay ningún problema. ¿Aquí? ¿Aquí?
¿Para quién es la pregunta? ¿Para quién
más
es?
aún, para el doctor o para la mesa, es igual.
Vale.
Bien, siempre hablan ustedes de vino tinto, y estamos de acuerdo, pero lo veo como un poco actualizado. De vino blanco no hablan nunca.
Es que no, perdone, es que lo siento.
¿Se oye bien o no?
Sí, así se
¿Aquí?
puede, porque aquí, perdone.
Bien, vamos a ver. Hablan ustedes siempre de vino tinto.
Sí.
Bien, de vino blanco no hablan nunca. Y actualmente hay vinos blancos que maceran con las pieles, que maceran con las lías, etcétera. Lo veo como un poco actualizado, porque también hay flavonas en los vinos blancos, hay taninos amarillos, hay antioxidantes, incluso, en los vinos espumosos, que se cría con las levaduras y tienen diferentes tipos de elaboración, etcétera. No hay el mismo nivel de antioxidantes polifenólicos en los vinos blancos, sobre todo los más actuales, y en los vinos espumosos. Esta es la pregunta.
Bueno, si quiero le puedo contestar yo parte de la pregunta, pero después también. Precisamente el doctor Struck ha hecho estudios en vinos blancos y en cava y comparándolo con ginebra, y también se observan efectos beneficiosos adicionales en el vino blanco. Pero es verdad bueno, que como usted mismo sabrá, el vino blanco tiene un nivel de polifenoles inferior al vino tinto. Entonces, claro, el efecto nunca es tan acentuado como el vino tinto, pero es verdad que tiene razón usted que no hemos de olvidarnos del vino blanco. Eric, do you want to say something more about white wine? They didn't have. No, they asked because they say that he said that we are always talking about red wine. And what happens about white wine? Because there is white wine with pretty amount of polyphenols, no?
Yes. There are polyphenols in both red and white wines, but they are not the same. As you know, the red wine is red because of pigment such as anthocyanin present in the red wine. But in the white wine, you have some polyphenol. The overall concentration is lower than in red wine, but you have some polyphenols, some flavonols, but not with the red pigment, the red color.
Hi, this is a question to Michelle, because to you, do you know?
What's funny?
This is a question to you, to Michelle, because I know that you like the polemic. So my question is regarding the mortality rate of this, that reduction in Predimed with 30%. Now, in mortality, the reduction of 30% with Mediterranean diet. So we also, in Inchianti study, we also found this 30% of the reduction in consumption with polyphenols. And I guess, and because it is a round table to discuss, how is your opinion about statistically, because why this 30% paradox, I don't know, or that the size, you know better as a statistician or know the population, because it's quite high. And I don't know, this is to discuss.
You're asking that in the Predimed study, when you look at polyphenols.
No, bueno, there's the reduction with the consumption of Mediterranean diet, and in a similar study, not similar because it's not intervention, but in the Inchianti study, we also found this reduction of 30%. And speaking of with a statistical, they say maybe it's the size or statistically this 30% is this, I don't know, your opinion. So that's the...
I don't think there's anything special or unique about 30% being found in many studies. I think obviously in observational studies you're worried about confounding from other factors. So, there are many studies that find a 10% reduction of having high vegetable consumption only from vegetables. So, I think the stronger the inverse association, the less likely you think it's due to other causes or that there's residual confounding. So I don't know, I didn't look at the Inchianti study. Was specifically polyphenols that you were talking about? That's from all sources, not just red wine, right? It's from polyphenols from fruits and vegetables and other sources. So, I think you have to remember that in observational studies, you have to think of what you're looking at as statistically holding constant everything else. So assuming that on average, people have the same amount of alcohol in each group and the same amount of exercise and the same amount of smoking, you see that reduction.
Well, this is a very important issue. Yes, I think so, because it depends the context of any study. If you are designing an observational study, usually you don't have what we call in science an a priori hypothesis. It means that what you find is something with large confidence interval, and you say, yes, it is statistically significant or not, but usually you have a specific population, and the absolute number should be taken with precaution. Now, if you make a clinical trial, you start with an a priori hypothesis based on the specific population you are going to study. For instance, if you want to study the prevention of myocardial infarction, the recurrence of myocardial infarction, you will decide to select a specific population of having less than 70 years, no diabetics, no familial hypercholesterolemia, and so on. But your a priori hypothesis is very clear. You say, I test whether with that population I reduce the risk by 20, 30, 40 or 50%. And then if your trial is successful, it means that you are within the confidence interval. But it is usually for specific population, because it is easier to make an experiment. After that, the extrapolation to the general population is very dangerous. You just have a new concept, a new scientific law or theory. It can be used by doctors to change the diet, to change the drugs of your patients, but extrapolation should be very prudent.
Okay, well, thank you. I think we will have to finish because, well, somebody has to go out and we have a lunch. So thank you very much for your presence.